And what we found to be the most important points, we all come from different backgrounds. Well, I'm in Sudan, which is in India, and then UK, and Thailand, and so all health systems are different. But what we found to be very common is technology. This is computers here. So the technology is important everywhere. Like here in the UK, like Carl was saying, how it's really important for prescriptions and things like that to get in contact with patients. In India also, how they would like to use technology to communicate between hospitals. And for us in Sudan, we don't even have that. We don't have computers in hospitals or in clinics. So there's really no electronic base or where patient records are stored. So any improvement in technology anywhere is very important for a good healthcare system. And of course, here we have the most important thing, the patient. Usually, so we want the patient to be the most important thing. Patients usually are classified into poor and poor and rich. Poor usually getting the worst healthcare because they can't afford it, because the best healthcare is private, which is only the rich can afford. So we want the main focus to be a patient. We don't want a classification to be either poor or rich. A patient should be looked at as a patient, not rich or poor, here or there, no. What we could come up with other types of classification according to, example, where a patient lives, or a certain disease, or things like that. Of course, here we have the healthcare providers, doctors. Doctors here, we'd like linkage or connection between doctors for medical record purposes, or I think this would be very cost-effective, time-effective, and instead of going to a new doctor every time and having to explain medical history every single time, but say, for example, they had a connection between them, this could save so much time, so much effort for the patient and the doctor. And here also what's very important is a link or a bond between the patient and the doctor so that there's positive and negative feedback. So we know that what services we're providing are good and what aren't good. Like, we can't just tell a patient to do something if they're not going to actually benefit from it. So very important to have feedback between them. And last but not least, the government, of course. The government makes the world go round. So here we have basically healthcare enthusiasts. They could be anything. They could be people from the community. They could be healthcare professionals, just people that want to generally help healthcare improve. So here we've got the important points like quality, which is needed, teamwork, education of both healthcare professionals, patients, the community, and standardization of health. So, of course, there's got to be a connection between the government and doctors, so there has to be some motivation. We've got to motivate the government. We've got to try to find what's best for our patients. And these red arrows also represent that how all of this are connected. This is one thing. Like, in order to do all this, we need technology, but we also need the government. Of course, we need the doctors. And who are we all doing this for? We're doing it for the patient.